ever been, and nobody.
All right, I didn't want to cut you off, but I
And
was just realizing he's waxing poetic, and we don't have this on record.
and it's absolutely perfect for figuring out what is I mean, who's your safe patients that you can do some general dentistry on, or who are the more complex patients that you need a little bit more investigation and diagnosis. So that's my general answers to it. But if you want to ask me the question, I can kind of go ahead and give you a real, and what do you guys want? Like 30 seconds to 45 seconds per?
Let's just go ahead and ask you the questions, or
Okay.
Greg, I don't know if you have it, Greg, but I sent it to you through Slack.
Oh, Slack. Okay.
Yeah. And then maybe we ask you the questions.
Okay.
Because, and I don't want to be on the video, and I don't want Greg to be on there either. So we can, and I don't know exactly.
What you need to do is if you make him, I don't have control. You want to make me.
Yeah, either that or I can hit record.
So what you want to do is you want to spotlight him. I guess the three dots in the upper right. There you go. All right, so now he's spotlighted. Perfect. All right.
And is my background pretty good? Is everything good about how I'm framed, or should I frame it?
Yeah, do that.
I like that. Yes, please.
That better? Okay.
Much better.
All right, so let me just do it this way then, so that, all right, that's a little easier to look. That's better. I get my finger out of the way.
If you can set it down so it's not too, if you're holding it, it's like we're getting a lot of motion.
Got it. So let me go and sit at this desk, and then hopefully the background won't be bad. I'm doing it kind of in our upstairs office, which let's try. How was that?
It's good. What do you think, Greg?
Yeah. Could you? Can you? Is it too warm to kill the fan, or shift your head over so
Yeah,
you're
let
blocking
me
the fan?
turn it off. Yeah, let me turn it off. And I've got a basement office too that I could use if this doesn't work as well. That way it's not distracting there. Let's try.
Move your head over a little bit more just to block that fan if you could.
To block it? Okay, got it.
It's sticking out. Yeah, that's not too bad.
I can go to my basement office if this is just like too distracting.
What's the background in your basement office?
Basically a blank wall. So let me go there. It's pretty much
So
no-brainer.
So while you're walking, let me ask you, how's Arden? How's Pam?
Everybody's good. Yeah, Arden is on a school trip to Iceland. Yeah, he comes back tomorrow. It's he's doing well. He got his driver's license I guess last month, so we don't see him.
Oh my gosh, dude.
Went to the junior prom.
Holy cow. I'm gonna guess that he's jumping between Wi-Fi's.
Yeah. Pam is also doing well, busy as ever, but is actually starting to make some time to chill out, which is cool. Yeah, things are good actually. I got honestly no complaints about pretty much anything.
Practice going well?
Practice is going well. I now officially have a partner.
No kidding. Wow, look at you're all grown up
for the last couple of years. Yeah, he's my associate for the last couple of years, and he basically told me in December that he'd like to buy in, and I thought it was going to be just like a buy-in, and he actually wants to eventually buy me out. So yeah, it's pretty cool. Do you like it up and down here, or do you want it sideways still? I can put it anywhere.
Let's see sideways again.
Yeah, I think sideways.
Sideways better.
Yeah, and then can you slide that door shut behind you?
Yes, absolutely. Which side? This side. Does it look better that way?
Whichever way, it's as long as it's closed. Just trying to eliminate the black. Oh, and close the other one.
Oh, yeah.
Perfect.
Okay.
Nice. All right.
Better?
Yeah, I think so. Perhaps you happy?
Okay, I just realized that I have a bookshelf on the wall that you can see, which I wasn't expecting.
Not worried about
Because I've
that.
done actually Zoom stuff from here, and normally you can't see the background. Maybe it's because, oh, maybe it was a tighter shot.
Well, and also your camera's up a little higher because it's on your
Yeah,
laptop. It's more eye level.
yeah,
That's
that's
not
probably
horrible.
it.
All right, we got your head. We got you framed. That's good.
All right.
All right, Travis. Let's see. So, all right. So, what I would suggest is, Raj, just give us an intro. Like you're meeting us for the first time. So, who
Okay.
are you? What's your name? And how long you been in practice? We'll take the easy ones off the
Okay.
bat.
All right. Hi, everyone. My name is, should I start like that or just introduce myself?
Yeah, just introduce yourself.
Okay. My name is Raj Upadya. I'm a general dentist practicing over 20 to 25 years at this point in East Hanover, New Jersey. I'm a senior faculty member with the Dawson Academy, and I've been practicing comprehensive and complex complete dentistry for 15 to 20 years at this point.
Tell us about your practice.
Okay.
As far as your makeup, what your typical patients and things.
All right. I've got a routine general practice that's got a large subset of complex occlusal and TMJ problems. But I do also have a general dental office side. Basically, the way our office operates is that we bring a new patient in and do a thorough examination, and then we determine whether or not they need to be on the complex side or if they can be on the general practice side. But I do get a lot of referrals for the complex care because I've gotten to be known as that. But that it didn't start that way. It started with just doing a proper full examination on all my patients.
Question: how did you, because you're familiar with Wizard now, do you remember what it was like before Wizard? You talk about.
Oh yeah, before I was using SmileWizard, we had to we try to create our own templates and try to remember all the different parts of a full thorough examination. And unfortunately, sometimes we would forget to get all the proper information. An assistant would forget to prompt me, or I would forget, I would glance over one area and forget to go back to it. So we get a lot of information in our thorough examinations, but it wasn't as thorough, wasn't as accurate, it wasn't as efficient. It was a lot more cumbersome in trying to get all the information. So our full exam process was taking quite a long time.
Talk to me about the time savings in your exam process prior to and now with Wizard.
So my new patient exams used to be about an hour and a half long. That included any radiographs and our full thorough examination. And my part of that used to be a solid 45 minutes of information gathering and getting to know the patient a little bit. Because of SmileWizard, we have been able to get all of the information that we used to get, plus more, in a more efficient timeline. We're probably down to, at this point, and we have been using it for quite a while, but we're about 20 minutes to get every single bit of all of the information that we need to have all of the data that we need for a patient. Now, my assistants do some of the visit as well. So our new patients, start to finish, is 45 minutes to an hour as opposed to an hour and a half. So it's quite a bit of time savings. Now, we spend a lot of time, getting to know the patient and stuff that some offices might not do. So the offices that don't spend that sort of time, you're still going to get a ton of time savings. And in ours, it was, I'd say, 30, 40% or more time savings.
So talk to me about why do you spend so much time with your patients?
So that spending time with patients is a really interesting an interesting topic. A lot of people feel that a full exam can be done during a hygiene visit, and you can get all the information you need and start kind of charting what caries or what restorations need to be done. We're more of a relationship-based practice. So spending a little bit of extra time getting to know the patient, getting to know their story, getting to know, where they are overall with the dental IQ, what sort of pluses and minuses they've had in previous experiences in previous practices. That all gives us a much higher level of understanding of our patient. And I believe it gives us a much more a view from the patient side that we care much more, which we do. We care a tremendous amount for our patients. We want to know pretty much everything there is to know about them so that we can optimize their oral health care for the rest of their life. So I think spending time with our patients, getting to know our patients, both from a dental standpoint as well as an overall standpoint, helps to build our doctor-patient and practice-patient relationship.
What hesitations did you have before using SmileWizard? Do you remember?
Yeah, so sometimes it would be, did we get all the, before I was using SmileWizard, sometimes we would fall short on forgetting to ask about a certain question, forgetting to get a certain bit of data, looking at their occlusal scheme, or we might have looked at their occlusion, but we forgot to look at their airway, or we might have looked at their TMJ and forgot to look at something about their occlusion. As thorough as we like to think that we were before, we didn't have a wonderful, concise and wonderful template for us to do it with it. And with SmileWizard, we've been able to get all of that information so much quicker and so much more efficiently and so much more thoroughly. So my hesitation before was whether or not we were getting all the proper information. Once we started using SmileWizard, my assistants can basically prompt me on the questions to make sure that I get all the data that we need. Prior to that, it was hard for the assistants to prompt me, so I had to remember it all. And I didn't want to look like I was going off of, like a worksheet or something like that. So I believe that my hesitation before was I didn't have as much confidence in my exam. Ever since I've been working with SmileWizard, my level of confidence on my exam to know that I have all of the data that I need in a relatively short period of time so that I can, get all of that other relationship and all the other information that I need and want to develop with the patient, that all of that hesitation has now gone away.
All right, that was the money shot. We can just wrap it up now. I think we got everything we need, Travis. That was that was really good.
That was great. That was great.
That's why I said, just ask me the questions.
Yeah,
Greg knows me well enough to know that that's kind of how it operates for me.
Nice.
Because it's all in here. It's just got to come out.
Right. That's great. So you kind of covered it, but maybe just go in now that it's a regular part of your business. What would you tell somebody? You see a lot of new dentists coming through Dawson, right? And working in your circles, right? After 25 years, a lot of dentists, even if they aren't Dawson dentists. What would you tell an untrained dentist about SmileWizard?
What I would say is that if you want to set yourself apart, if you want your patients to understand that you're different, that you're looking at things that nobody else is looking at, that you're going to be more thorough, that they can trust you, that they know that you have their best interests at heart, you're getting all the data, all of the pertinent information to really truly be the advocate for their patients' health, their overall health long term. SmileWizard is so crucially important for that because it lets the patients know that you care and that you're thorough. And I think especially in today's market, when doctors and patients have maybe minutes of face time and a thorough examination is measured in 5-minute increments, I think that SmileWizard sets you apart so that everybody knows that you are not one of the many. You are a special office that's going to take the time and effort necessary to care for them at the level that they deserve.
No, Travis, this is really a tough interview. Okay, well, we'll see what we can do. I'll add music.
Was that good?
That was awesome, dude. I'm just busting. It's been a while since I busted your chops.
I know.
No, that's really good.
Okay.
We already kind of covered what your reactions. What are some big wins that you've had with SmileWizard where you're like, oh my gosh, like SmileWizard just, I don't know if I would have done that, or man, that really saved me from going down the wrong path. Is there any particular stories you could share?
Yeah, no, absolutely. The beauty of SmileWizard is that it has, because of the web-based format and because of how simple it is to import the data into it. The wonderful thing is that if a patient calls and a staff, feels like an emergency or some sort of situation of what sort of issue they might be having, I can refer back to SmileWizard and basically in a very, very, very quick few moments, get to know the patient again or understand what a patient's overall situation is in about 30 seconds. I can look through and say, oh, what are they calling about? What's the issue? Okay, and go back, look at their clinical chart real fast, look at SmileWizard real fast, and basically know what they might be coming in for. And so it's kind of like giving me a magical ability to pre-diagnose what a patient's emergency or what their condition could be. Because when we get all this information, once in a while, a patient necessarily doesn't do anything about it right off the bat. And so it might be a few months later or, 6 months or after another recall visit. But we have all that data. And the beautiful thing about it is I can access that from anywhere. I don't have to be in the office. I can do it from my phone, my tablet, my office computer. It's just so easy. And to be able to update that information is also ridiculously easy. So I think it's an invaluable tool.
Who would you recommend SmileWizard for? Like, who would it be a perfect fit for, other than like a Dawson dentist? I mean, that's pretty much like a softball over the plate. But just thinking about, with SmileWizard, you've got your Dawson audience,
Yeah.
and trying to push that, like you said, nowadays it's more competitive, right? So it's a competitive edge for anybody if they have all that data. If you had to paint like a perfect user for a SmileWizard, knowing what you know, what does that person, what does it look like? Is it big practice, small practice? Are they, or flip it over, if you need to shift somebody's paradigm, right? Most dentists nowadays, we were just looking at the stat last week on the ADA site of recent survey, 40% of dentists are suffering burnout.
Yeah.
So how does SmileWizard kind of help to alleviate that problem with these dentists? Yeah, I know what the answer is for why most of these people are burned out, but I'm curious to know, like, A, what your feeling is on that, and B, how SmileWizard can alleviate some of that burnout.
So what I love about SmileWizard is that I believe that it's truly universal. Now, without question, for an office that's already trained in more complex care, it has every bit of information that you need to diagnose fully whether or not a patient's got occlusal issues, bite issues, airway issues, TMJ issues. There's no doubt it's ridiculously invaluable. However, even if somebody does not practice at that level, but they just want to up level their office a little bit, it has, so even in the basic parts of the exam in the SmileWizard, you don't have to fill out everything that's in SmileWizard. You have a choice. You can skip over a section, and if you just want to improve how you're presenting or how you're managing a patient a little, you can spend just a few extra minutes and do some of the modules in a SmileWizard. That's what's beautiful. You can cater this to however you want. So if it turns out that you want to get all the data, by all means, put it in. It will up-level your practice and your game so much. There's sky's the limit. But even if you wanted to do it incrementally, you can just ask a few more questions that's within everybody's wheelhouse to look at, and you can put that data in. And I hate to say this, but even if you don't do anything about it, you're already setting yourself apart. The patients just realize that you're not just counting teeth and you're not just looking at cavities.
Can you give me a couple of examples of what you just talked about with, you don't have to go through the whole exam, even if you're like a novice. What would be some of those screens you're talking about?
So you might ask for some of the historical questions in the TMJ section. You might not know what to do about everything yet, but just asking the historical questions about, have you had an injury? A lot of times people don't talk about, whether there's been an injury to the face, whether or not there's been a TMJ problem. I mean, how wonderful would it be to know that a patient's already been either diagnosed or had some major trauma before you went and, did some major long-term or a long procedure on a patient? If you asked even the screening questions and realized that somebody had some issues, it might make you just realize, hey, maybe I don't want to have longer appointments with the patient. Maybe I want to do shorter appointments. This person already has told me in their history that they have some TMJ issues. Maybe I want to be a little cautious. Maybe I want to make some sort of a night guard. It might make you just think outside the box a little bit to maybe change up your care so that you have less frustration and less discomfort from the patient standpoint. When it comes to the other modules, I mean, it makes you look at perio a little bit, looks at abfractions, recession, whether or not there's mobility. There's not a lot of offices that are looking at mobility. Even if you don't want to talk about occlusion and the, all the other, occlusal related things that you can do for somebody, if somebody's got mobility on their teeth, that might need to be addressed in perio. So, I mean, a lot of people are not looking at that. They're just looking at just pocketing. And SmileWizard has you look at all of that. So once again, you don't have to do every single part of every single module of every single page of the exam. But if you add one page, that's already setting yourself apart. If you get around to adding another page, it's setting yourself even more apart. So the more you implement it, the more thorough you're going to be, the more you're going to set yourself apart from all of your colleagues, and the more the patients are going to feel that this is an office that I trust. Now, if you want to really, really do wonders for yourself, you got to back it up with all of what to do with all of the information. But even having yourself have that information is better than not having.
Talking about, do you work with a lot of specialists with your cases, and do you use SmileWizard to communicate with your specialists in your lab?
So once, I mean, I give my labs access to it at will, so they know how to access and see all the data and all the information that we have. I have sent the PDF to my specialists. The nice thing is, if I'm having a conversation with a specialist, and we sometimes after hours get information or get a call or a text from a specialist. I'm not necessarily in the office, and they ask about a patient. And it is amazing. Even if I don't shoot them over the info, which I can like in 2 seconds, I can actually at least access it and talk about it. And if I send off to a periodontist or orthodontist for a consultation, they're like, hey, can you talk about so-and-so? Sure, no problem. I pull up my SmileWizard exam, and I can talk about the patient as if they're in front of me. And if the patient, if the specialist wants some of that information, I can shoot off that PDF in about 5 seconds. So it's wonderful to communicate with specialists in the laboratory. I think it's absolutely invaluable.
So I have a quick question to ask. As you look back on your history, I mean, you were at some point you decided to go to go to the Dawson Academy. You wanted to level up your practice. You wanted to learn more. Um, when you and at some point during that time, you started to get more and more referrals.
Yes.
Did SmileWizard maybe talk about how SmileWizard might have been key to becoming a doctor that is getting a lot of referrals and is kind of seen in that space as, you know, this is a guy who we've had a lot of success with, et cetera. Does that make sense? Like go
Oh yeah,
back in time
absolutely.
and relive that.
Absolutely. So after I went through the Dawson Academy and after I started learning all the information that I now know, it definitely up-leveled my practice already at that point because I just had more knowledge. I started implementing a better exam than I had before. I was a little bit cumbersome in the process because we weren't efficient in any way. So the patients were there for a long time. So I did get some referrals based on that. But once we implemented SmileWizard, our efficiency on how we were gathering all the information increased so much that I could get all the data that I needed to be able to have a very intelligent conversation with the patient very quickly. And basically, the patients then started telling other patients about what it was like. Oh my God, you're going to go there, you're going to spend a little bit of time, but he's going to do the most thorough exam on you that you've ever experienced. I started getting referrals of patients' family members, work colleagues. And sometimes it'd be something like somebody would be at work and something would be going wrong with them and they're having a problem with their dentist. And I'm like, oh my God, you got to see my dentist. He takes a look at all that stuff. I mean, you never would believe the sort of information he gathers. And it was just this resounding word of referral base that started getting better and better. And it used to be that it happened, but because of the time commitment that was involved, it wasn't happening as much as it could be. It could have. And then once we started implementing SmileWizard, we can get all that information fast. I can actually shoot it off to the patient if they wanted. It just became a thorough amount of information gathering in a much more efficient way so that patients started talking about us. And that in the last 5 to 10 years, the amount of growth has been outstanding.
Do you ever get referrals from other doctors?
Oh yeah. So that's where this is kind of morphed to at this point. It used to be patient referrals. Then once in a while, it would be a doctor who kind of knew about what we did and why we were a little bit different. And oh, you have a bite problem or a TMJ problem. Raj might know about it. But now, actually today, I had a new patient referral from an orthodontist. I had a new patient referral from an ENT surgeon, and I had a new patient referral from another patient. I don't think it can get any better. My referral patterns now can be absolutely anybody because I have the knowledge, I have the data gathering and the knowledge to be able to treat all of these patient populations, and my specialists around me understand that. And so the moment they feel that somebody has more complex needs, they started referring to me. And that's happened over the last 5 years. And during COVID, where everybody was having so many problems, it's weird. My referrals started getting better. So since COVID, it's been a great trend for the practice.
What do you attribute that to? Certainly not COVID.
No, definitely not COVID. Well, I think that during COVID, a lot of people started having some more problems, whether they were out of care for a while. The amount of stress that COVID caused for our entire world was pretty significant. So bite problems, airway problems, TMJ problems, they started, going through the roof. And when people went to their either their dentist who didn't know what to do something about it, or their physician. I've also made a very good relationship with several sleep physicians or surgeons. It's been kind of amazing. Whichever way that they ended up having a problem, ultimately at some point they end up needing to see me. I've got a physical therapist that I work with that deals with a lot of craniofacial issues. They're running into a little bit of a struggle. They refer to me. My chiropractor now refers to me. It's kind of cool, and it's a it's a two-way door. So anytime I refer to one of my specialists, they might then also realize that they need to refer back to me. It's not like everybody goes to see all of us, but it's a matter of which combination of referrals we need to treat some of our more complex issues. And it's since COVID, the amount of stress and the amount of issues that people have had, it's just it's been a higher percentage than I've ever seen before, and I haven't seen it gone down since.
Talk to me about your the sleep aspect of this, because you mentioned the sleep specialist. I remember, Pete had his 4 circles, and now it seems like there's like 18 circles. You might as well just circle the
I know.
entire
I keep on thinking
upper
that we
part of
need
the
more
body.
circles.
Yeah,
There's going to be another circle at some point. It's going to be like the neck or the shoulder or something. Something will come up eventually.
If Alex Kim has his way, it's going to be the spine. But yeah,
it's exactly cervical spine. I think that with airway, and it's so wonderful that that airway is part of SmileWizard. The beautiful thing is that a lot of people don't look at it at all. A lot of people didn't realize that there's connections between airway insufficiency, sleep disordered breathing, along with occlusal and TMJ issues. We now know that they're all intimately connected. And a lot of times the source is the airway, but you don't want to do any dentistry that compromises the airway. And if there already is an airway problem, you want to make sure that you are addressing that in conjunction with anything and everything else that you do. So the inclusion of airway issues in SmileWizard, I think, allows us to talk about a conversation we never used to talk about. And whether or not you're going to get into appliance therapy or things like that, or whether you're going to get into orthodontics or orthognathics or whatever it might be that you choose to do to correct the issues, if you don't have the data in the first place, you can't talk about it. And SmileWizard has us look at mal and potty. It has us look at whether the tongue has been constricted. It has us look at whether or not somebody has any upper airway resistance, whether they can breathe through their nose, whether they are mouth breathers. It's kind of amazing the amount of data we get along with the Epworth sleepiness scale to know, is airway something we should be worried about in this patient, or is the airway okay? And in a routine examination in most offices, that's not even on anybody's radar. So even asking those questions, the beauty about this is that if you add that page into it, you might save somebody's life.
Mic
I
drop.
only wish you were a better interview. Okay, well, we'll put this together in post. We'll make it look better. Just 2 more questions. I want to be cognizant of your time. Thanks for all this. Couple of things. I want to focus on some negatives, right? Like, so,
Okay.
One of the feedbacks that Travis did when he was doing interviews with people that have used it in the past or whatever, and why they don't use it anymore, or why they don't use it enough. One of the things that I heard that really stuck with me was the doctor said, "I don't necessarily buy into the dogma." Was that it, Travis? Or was something to that, like, she mentioned the dogma word, which you've heard before, right, with Dawson and the dogma. What would you say to somebody that says something like that?
Well, I think that, there are people who sometimes want to bury their head in the sand and just keep things as simple as it can be. Unfortunately, I think that when we don't look at some of these things, we're causing ourselves more stress, our patients more stress. I think that just ignoring things, at least in my opinion, is irresponsible. And I think that even if we don't look at all of the things that we have available to us in SmileWizard, I think that it's our responsibility to look at more than just whether or not a patient has a cavity, because whether we like it or not, a dentist is the physician of this area. And that involves more than just looking for cavities. I know that's what the trend had been for a while, is it's like, okay, tooth number 3 needs an OL amalgam and this, that, and the other. And I think it's our responsibility to give patients the level of care that they deserve. And SmileWizard at least keeps us more responsible. And frankly, it keeps us more profitable. If you spend a few extra minutes looking at a few extra things, the amount of dentistry that you could theoretically find that you need to do for somebody can be a huge boon to your practice. So I don't see any downside. So the dogma of, I don't buy into this. I mean, there are some people who don't want to buy into anything. And, to each their own. I'm not judging it, but I just think there's so much more that we can do to benefit our patients and our practices. And SmileWizard allows us to do that and do it in a very clean, comfortable, efficient, straightforward way. And the few extra minutes that we spend, I think, has leaps and bounds of benefits for our patients and our practice.
Yeah, I saw your question there, Travis, and that was going to be my last question. So, I said about the dogma. The other negative is obviously there's a cost associated with it, right? And I think it's relatively low for the amount of payoff, like you said at the end. But obviously everybody's always going to be penny conscious and not seeing any kind of value in it. Can you talk about the ROI, right?
Yeah,
the return on
absolutely.
investment.
Yep. So I know that there's a cost to SmileWizard. There's a cost to almost everything we do in our business. But what I like to look at is where time and money is well spent. If I can be more efficient, gather more data, so I can basically evaluate a patient when they're not in the office, I can actually spend less time in the office with the patient or spend as much time as I want to. So the ROI is, first of all, I get to get more information that I might have missed otherwise. I get to get it efficiently, so I can do a 20-minute exam that gets more data than people would get in almost any other exam. But I get to have that in a very, very efficient, easily accessible manner. And so that when I go to present my findings to a patient, I have it all in such a wonderful, like beautifully laid out way that a patient realizes, what care and what thoroughness, what our level of overall, what's a good word for it? Our level of thoroughness that we have done in our examination for the patient. So I think that where the payoff is that you get to get more information efficiently, and then you get to present it pretty efficiently. I mean, if you just present your SmileWizard exam to a patient along with whatever restorations they might need, already a patient is going to be thinking that it is something so special and so different. And so I think the ROI for me is that I don't miss anything. I have data to show a patient. I have data to work with a specialist. So the small costs that I spend, I get that in tenfold or more, actually much more than tenfold in what I end up presenting to patients. So for me, honestly, it's just a no-brainer. It makes me faster, more efficient, thorough, and gives me the ability to do better overall care for my patients.
I'm good. Travis, you got anything?
No, I think that was absolutely amazing. Thank you so much. I really appreciate it.
You're welcome, guys. If there's any follow-ups, just let me know. I mean, if there's any other things that either come up when you think about it, just let me know. I'll do this at any time.
Yeah, no, we'll send you some.
I mean, it is literally like an integral part of my practice. All my assistants know, don't tell me to come into the room for my new patient comprehensive exam until SmileWizard's open.
Wow. And you know that we're going to be so I talked to Danielle while we were there, and she's agreed to sort of talk through this as well as an office
Oh,
manager.
cool. Awesome.
Yeah.
Oh, that's
So
great. Because
yeah.
she knows basically, I mean, she initially, the first few times I was telling her that, oh, yeah, this is how much time I need for a new patient, she was just like, what? She's like, you don't do the new patient in hygiene? And I was just like, yeah, no.
Yeah.
We try as hard as we can to have that separate. I mean, we're not going to say, no, you can't come to the office, but this is how we'd like to do things if you don't mind. So she knows the value. She
Well,
absolutely,
she
absolutely knows the
absolutely
value.
does. And she's got to be so valuable to your practice, to be honest. I
Oh my
mean,
God, without question.
the way she thinks about it and thinks through these things and the amount of things that she takes on in your practice is pretty amazing. I
It
could
is,
get
it's
that
pretty
just from
amazing.
that was in casual conversation. I'm just like, wow, this is
I've
amazing.
I've been very fortunate. I really,
Yeah.
really have. I honestly can't. My entire team and even my previous teams, I've just been very fortunate in that respect. I mean, I think that in some respect, like whatever, like gravitates to like. I think I'm nice to them. They're nice to me. I just happen to hopefully attract, the people that we really want around us. So
Yeah.
it's really cool.
That's
It
awesome.
is
Raj,
awesome, and she is amazing.
using SmileWizard with your team because they have access to it. Does it has it leveled up their game and increased their level of knowledge without you having to be in the room? And like, are they becoming naturally curious about, oh, hey, what does that mean? Or because they didn't come out of their training knowing this stuff either.
Oh yeah, actually, so the person who one of more relatively more recent hires is my hygienist. She's been with me now probably 4 years or so. Um, she came from a very, very comprehensive, or at least well-known practice a couple of towns over. Once she joined me, and once she actually even heard part of my exam, she had to pull me aside and said, I can't believe how much wonderful, thorough time you spend with your patients. I was like, I don't know anybody who does anything like this. And I see the results of what you've done in your care for them. So my hygienist starts, it's weird because we have some patients who want to have hygiene and a new patient exam on the same day. And we don't say no. We just say you're going to be here for longer. And once in a while, depending on how the schedule is, my hygienist might see the patient first. I try not to have it that way. I try to have it whether so that I can have see the patient first, but sometimes it goes the other way. And when it does, the hygienist, as she's doing her initial evaluation and screening and saying, is this a prophy, not a prophy? As she's handing the patient off to me, I hear her say, she says, oh, by the way, you're going to have the most amazing exam you have ever had, ever. And the handoff is just like one of these, oh my God, the patient's like, okay. And then they come out of it. And I hear once in a while that whispers afterwards, they'll look back at the hygienist and said, oh my God. It's amazing. Absolutely amazing.
Well, much like this interview. This was great.
Yeah, seriously. So good.
Yeah. Yeah. No, hey Raj, it was a pleasure, man. Give my love to the fam, please.
I will. I will.
Next time you
All
see
right.
him.
Let me know if you guys need me for other stuff like this or any updates or different things. Just let me know.
You're
Absolutely.
amazing. Thank you
Thanks,
so
brother.
much.
All right. Thanks,
Talk to
guys.
you.
Bye-bye.
All right. Bye, guys.